so much, everyone, for still staying with us. It's good to know you are still there. Now we are moving on to the conversation proper, and that's talking about COVID-19 and matters arising, which is very, very key at this point in time. All right, let me give you a little bit of the background. Last week, between August 16 and 22nd, Nigeria recorded a total of 3,137 cases compared to 2,628 cases recorded in the previous week. This shows Nigeria recorded 509 more cases last week. As of last week, which marked the 34th week since the beginning of the pandemic in Nigeria in February, only 378,000 samples have been tested, 51,000 cases have been confirmed, 38,000 recoveries, and 997 deaths. Data from the Nigeria Center for Disease Control show that there is a reduction in the number of tests conducted last week when compared to the previous week. While 27,000 tests were conducted last week, 32,000 samples were tested the previous week. And this is what we shall be looking at this morning. Are we making progress in the fight against this pandemic? Are Nigerians relaxing? What exactly is happening? I have with me a guest in the studios. He is a forensic pathologist, Dr. Uwon Eze. Good morning.
Good morning.
It's good to have you here this morning. Yes, we know this is your field and you have seen so much, and we're talking about the fight against COVID-19. We have noticed that some are already relaxing. They are thinking, oh, we've heard enough. It's like we are moving past this COVID-19. And what the WHO has said that with modern technology, in 2 years, we might actually overcome this. What are your thoughts on this?
Thank you. It's difficult to make definitive predictions about how long COVID-19 is going to last. However, sometimes if we take a little bit look at what happened in the past, and we will be able to evaluate the present and predict the future. So if you look at previous pandemics that we've had in living history, and you can remember in 1918 flu pandemic, and it's not something that you can put a finger on the day and say the disease is going to be gone. What may happen in months and years to come may be that the big screens may refocus. Other things may get our attention. And we might just be, fatigued. Fatigue is setting in everywhere. But people just want to move to the next thing. But in terms of the virus, the virus doesn't listen to your pronouncements. So it's acting within the environment that enables it to act. So for as long as those measures that prevent the infection are not in place, there's no amount of prediction that is start. And I do not even foresee it being completely wiped out. I think we have to dedicate to the reality that COVID-19 is going to be with us for a very long time.
That being said, there are some school of thought that actually believe that the viral infection with time will actually thin out, and later it might go to the background with modern technology. Do you subscribe to this?
If you look at the behavior of viruses, like most diseases, sometimes you are in a dynamic relationship with the germs. You find them, sometimes they go back because the environment supporting them, the anchors may have been taken off with a bit. But then society relaxes. Something comes from the same and there is a resurgence. So it's been the kind of seesaw relationship we've had with diseases over the years. So what I just want to sound out is that it's too optimistic for anybody to say in 2 years' time any amount of technology is going to wipe off COVID-19. That is not likely to be. Meanwhile, there's nothing that's impossible. But if you look at diseases we've dealt with, we still have hepatitis today. We still have HIV, despite all the global effort against it. We still have flu. We still have common cold. So COVID-19 is just added to the mix. And coronavirus is everywhere else. This is just a new strain of coronavirus. So I do not see it just being completely wiped off by any technology. But if we sustain efforts at infection prevention and control, we might see it recede. And then human beings will just achieve a kind of steady state with it, and we can go on with our life, but there will be flare up from time to time, like you have indicated, when the environment is right for
Still talking about the WHO and UNICEF, they did not recommend that children under age 6 should wear masks.
Okay, this is the recommendation of the WHO that I'm aware of. From 0 to 5 years, it's not recommended. Now, that's for a lot of reasons. A child in that age group has a lot of developmental and psychosocial needs, and even the ability of the child to understand wearing masks and get into things that you want to keep wearing masks is going to be very difficult. So we may actually be doing no harm than good. But from 6 to 11, there is a gap for assessment depending on how intense is the transmission in the community that the child lives, and how the child is able to comprehend the essence of wearing it, and other assessments that may be done. So it is not required, but may be necessary based on this assessment. But from 12 years and above, the WHO recommends that children in that age should abide by the same guidelines that adults
I
are.
actually asked that question because we have a situation where we have reopened our churches, our mosques, and
Yes.
but children are there. So how do we
yes.
ensure their safety?
And this is a very important. I'm concerned. I've taken a look. Almost every Sunday I drive around whenever I'm going to work, and I see churches open, Ibadan for example, and nobody is really monitoring the infection prevention and control measures in those churches. And I've taken a look and see the whole church is filled up with people. I mean, this is a real danger. And we might see some more time, but like you mentioned, it might appear that the virus we are having less cases this time, or less number of cases, and suddenly we're just incubating for the next 2 or 3 weeks, and another being unleashed by more cases. So churches were in large gathering. Any religious gathering now, we need to be taken with a lot of caution. So because people are talking, people are singing, people will be sneezing in a confined place, and people are not strictly using their mask, and other infection prevention control measures are not strictly in place. I'm worried.
So is there a lot of situations where people actually put it on the jaw? They are not actually covering their noses because they believe I want to talk and I want the next person to hear me.
And that's the problem. Now, look at the distance between you and I, allow us to be able to speak, and even the way we are sitting, without the need for a face mask. Because at least you must maintain by the WHO standard at least a minimum of 1 meter. But even in some jurisdictions, they stipulate 2 meters. So, but in those churches, they're very close. And when they are talking, the irony is that he's pulling down his mask to talk for the very reason that the mask is actually put on. Because those tiny droplets that will come out when we are talking or singing or doing such activities, we are no longer preventing the droplets. So those droplets now, people can inhale them at close proximity. And if they are infected, then you can see the transmission of infection from that to their contacts in the community, and then we see a resurgence. So I think that I'm not saying that we have to shut down places of worship forever. And I'm saying that there should be more monitoring of what takes place there for the safety of people attending the every larger community. So I always expect that monitors and people in task force or anybody in that kind of work should be able to just go out and do small checks and see what is really taking place in these places of worship to ensure this is a public health issue that the entire public is kept safe. One person could infect the immediate community, and the immediate community will infect their larger community, and that's how a whole community, society, or state can go back to where we were before.
And what is the issue of implications? Because some people have said that in Africa we are so lucky, we are not recording deaths like they are recording in all the climes as it were, and that makes people more relaxed that even if you contract it, you can get over it.
But what is our evidence to that? You just talked about the number of tests we're doing. We're not doing enough. I mean, look at how many tests have we done in Africa? How many tests have we done in this country? What is our population? You just read out statistics. So how can you really say that we're not recording cases when we're not doing enough tests? So I think we need to base this on evidence as we know it, the science. I know Africa, we are very optimistic people, but we don't have the evidence to make this statement that we don't have more cases until we are doing enough testing.
And some people have talked about COVID-19 deaths, that is always due to complications due to underlying illnesses. That if you do not have illnesses, like if you do not have cancer or you do not have diabetes, you may actually not die from COVID-19.
There's some truth in that. COVID-19 could kill on its track. It's a respiratory disease. And it can cause pneumonia, just like other things that could cause pneumonia with a special feature. And that has been described in many writings. However, if people have other diseases, like hypertension, other heart diseases, asthma, diabetes, cancer, or some chronic illness, just like in most other diseases, it makes it more difficult for them to survive. And when they have disease, they have more severe forms of that. So you're right. But COVID on its own can kill. I mean, the changes in the body that we have seen, they are capable of killing by itself. But when people have these comorbidities and other diseases, the chances of dying are more. And generally, COVID-19 is not a scary disease. I mean, almost 80% of the people who have mild diseases or moderate disease, and some of them may not even require hospitalization. But for those that have serious disease, and especially those with comorbidities, it's a challenge managing them.
And that's explains the issue of the grassroots, because in urban centers, they understand that if you have the symptoms, go to call the nearest hospital or let them come and check you up. It might be COVID-19. But we have a situation in the grassroots where they believe in herbal cure, home medicine, self-treatments, and self-medication, and thereby spreading it. And like you mentioned, the issue of testing, how many people do we actually test?
Now, that's where we need to talk about it. This COVID made us really look for COVID. COVID came to us. And sometimes there's a need for some sympathy in the public. I mean, most of the symptoms that COVID, the symptoms of COVID could be found in other illnesses. I mean, fever, cough, tiredness, pain, diarrhea, difficulty with breathing. This is going to find many other conditions. In fact, sometimes COVID will look like malaria. So you can see the problem. If you're not testing enough, and people just feel like it's just malaria, there's a tendency for them to look for alternative means, things that have worked before. So we need a lot of public enlightenment to let people know in a language they will understand that this is different. It may look like malaria, it may sound like malaria, but it may not be malaria. And so there's a need for us to reach out to members of the public with patience and also make it easier for them. When people know that they are going to queue for a long time before they have any tests done, they have to travel, and then it's going to destroy their lifestyle, it's going to destroy their means of livelihood. They will rather take some alternative means of possible treatment than going for testing. So it's a whole lot of putting everything on the table. You have to consider the sociology, the psychology, the culture, the religion, the economy. So when we talk about COVID-19, it's not just the science. We need to talk about the art of COVID-19, how to engage the community, how to make them embrace the message we are giving to them, and how to make it easier for them to assess certain modalities like testing, and also to even be able to report that I think I'm having these symptoms, perhaps I need to be tested. And also to make it, to destigmatize it, So now we're having very high profile people, and we need more of those people also talking about their survival, talking about their experience.
Cerebral palsy is a rich man's disease, really.
Exactly, but it also affects the common man. It affects everybody. But what you just want is a situation whereby we have the public discourse of COVID-19 as a shared responsibility, and then people are met at certain level of their needs to assist them to do the right thing. So at the local level, we may have challenges for people having to resort to taking herbal precautions, which may even do more harm to them because it may damage their organs. These are not medications that are already being measured in appropriate. They're just taking all these things on themselves. It could damage them we should not just condemn and say this is not right. We should provide them with alternative. And that alternative should not be more grievous than the situation they are already in. So I believe that for COVID-19, and I think it's come to stay with us for a long time, we need to engage community, public enlightenment, creating awareness, reaching out to people in their various localities, speaking a language that they understand, and destigmatizing COVID-19.
So from our experience and from the statistics, do you think we are making progress in Nigeria?
That's a hard question. It depends on the indices you're looking at. But allow me to say yes. And I'll tell you yes for a reason. There's been, throughout the whole country now, there's no place you will go in this country people don't know COVID-19. And we call it name Koro and things like that. But anyway, for government and authorities at different levels to have, enable and share this information that gets to everyone. It's a progress, but not its own. So people are talking about Google in Nigeria everywhere. Secondly, there's been an effort out looking at our healthcare services and everything. That has come to the public discourse about how low we are and how low we still are. But for us to be discussing that, and people can say that our healthcare system was so fragile, it is still very fragile in terms of helping the communities, the populace to cope with situations that is a progress. Because it means that there is a possibility that something can be done about it. And there are some baby steps that are being taken in that direction. Centers are being created, some treatment centers are being built, hospitals are being equipped, the value of healthcare workers is being appreciated. I think it's a progress. And then the government agencies are also trying to, wake up and increase the capacity of the country to test and treat. Now, that you may not see it in statistics now, but I'm aware that where there were no labs, now we have labs. And more labs are being created, and more treatment centers are being created. And so all these things, we may not see all the effects right now, but when we are confronted with a similar challenge the next time, the same principle and the same infrastructure and the same approach can be used in treating those illnesses, even when we are dealing with the existing COVID-19. So, allow me to say yes, we are making some progress, but a lot more could be done. And it is not time for us to start patting ourselves at the back and say, oh, we made progress. It's time for us to begin to ask ourselves, how do we actually sustain this progress going forward?
Now you mentioned the issue of doctors who are actually frontliners. That brings me to the question. We know a lot of medical personnel and these frontliners have come in contact, that they have come down with COVID-19 at the point of all the other. The latest is the Commissioner for Health in Lagos, who was actually very, very active as it were, and eventually actually came down with COVID-19. What are those parameters? Is it that they are not taking adequate precautions, or there's nothing we can do about it?
Okay, pardon me to go back to the statement about the doctors being frontliners. That's good. But it's not this. I use healthcare workers. Healthcare workers, doctors, nurses, pharmacists, physiotherapists, medical lab scientists, they are a lot in the hospital. In fact, including drivers, health attendants. So the fight against COVID-19 is not just doctors alone. The doctors are standing with other healthcare workers and are seeing unity. In fact, COVID-19 has brought a lot of unity in the health sector. That we work hand in hand together with all healthcare workers. So these are frontline workers. And about the casualty we usually experience, one of us getting COVID-19 and things, is not, we can say because they are not taking enough precaution. It's very difficult. Sometimes it's very difficult for you to really go through a case investigation to know how somebody got COVID-19. But it's always almost a matter of time. When, not if. When you have a community transmission, you can't be too careful. I mean, it doesn't matter how careful you are. Something, especially when you're right there in the front line, it's a virus. A little bit of opportunity, it gets on you. And so, for doctors who are in the front line, for nurses, for other categories of healthcare workers, it's a dangerous job that they know they are doing. They know that they are exposed. and we're proud of the work healthcare workers are doing. And I think the nation and everybody has to acknowledge that healthcare workers, a second look in terms of how healthcare workers are valued in this country. We should take a second look and prevent the brain drain, and also ensure that those that stay in this country know that they are acknowledged and valued. So because at the end of the day, they pay the price, often, sometimes, with their lives in serving the community. But that's what we sign up for. So, but it should be appreciated. So I will not say it's because of lack of taking appropriate measure. It is just the situation we are in, that anyone could contact it despite the best of care.
From what you said earlier, you actually talked about frontliners, because now it has exposed what is happening in the healthcare system, how fragile it is. So what are those things that you think that the government should pay more attention to, especially when it comes to healthcare in Nigeria?
We should look at our system. We should build systems that are sustainable. I mean, what is our long-term goal? What is our primary, secondary, and tertiary healthcare plans? And what is, how do we want this plan to pan out, to go into the future? What are ways of implementing them? And also sustaining what we've done. If you look at communities, we need to really have new data to know what are the needs of the communities and what are the health structures, both infrastructure in terms of bricks and equipment and personnel. So it is time for us to really tell ourselves the truth. Can we really take care of the healthcare needs of the country? How many doctors do we have? What is the ratio of doctors to members of the community? Do we have enough? And then how many doctors do we need in 5 years or 10 years to meet the needs? We have to have a system and a plan. It should not just be people with medical school. These are all planned. You produce the number of healthcare workers, from doctors to nurses to everybody that will serve your population. You keep them and you make them comfortable. And not only in salary, sometimes we think it's salary, just providing an enabling environment, a hospital, something that they can work with equipment, with what they need to really feel that they are fulfilling their calling. It's enough gratification for any staff. It's not just salary. So we need to look at, if you train a cardiologist or a pathologist or a gastroenterologist, and he doesn't have the tools to work, it's going to be frustrating. He has to look for a way he can express his art and practice. And that's why many people are living in the country. So we need to look at the system. And not just building hospitals, but also look at what are the equipment and facilities that should be in this place at every level. So you don't need to come to UCH at just every headache or fever. There are primary health care centers that you can just walk in, and they have necessary equipment and facility and personnel to attend to you. And then you see it will not be crowded by everybody from everywhere, for every
Specialist hospital.
Yes, especially we are actually operating at quarterly level, at highest research, teaching, services at the highest level. But if you go to UCH, you do everything from primary health care to secondary to tertiary to adult. So we need to build systems that are backed by infrastructure, contemporary facilities that will take care of today's
It seems like we should go on and on, but time is not on our side. What are your final thoughts on this issue of COVID-19?
I think it has come to stay for a long time. And I think it's time we took it seriously. If we become complacent about it, what will happen is the changing face of it. People may hide, but that doesn't mean the disease is not there. People may be dying quietly, but that does not mean that the deaths are not occurring. It may just mean that we're looking at it the blind as well, and we're not seeing the real thing happening in society. So my thought, and maybe it is that it is not yet time to relax.
This is not yet war,
Yes.
and I think we should take care of it.
Vigilance.
Thank you so much, Dr. Uwon Eze, for coming on here. Cafe, we quite appreciate. He is a forensic pathologist and has been sharing his thoughts with us on COVID-19 and matters rising, all that we should know. Okay, I would like to take another breather. When we come back, another conversation with another guest. Do stay with us.